Welcome to the Power of Peacefulness podcast. Today we have Dr. Diana Stafford with us. She's going to be talking about mold, and we are also going to be talking about how our stress levels can actually interfere with our immune response and how mold plays into that. I learned so much in this episode from Dr. Diana, and I hope that you do too. I know that this can help others, so be sure to share it. Talking about stress relief, I wanted to introduce my journal book. It has over 570 journal prompts. It is designed to help you with stress relief. So if you're not used to journaling, try this. Prompts can help. Otherwise, just sit down with a pen, a pad, and just get your thoughts out on paper. It does make a difference. You can find that on Amazon in the show notes, the link. Let's get started. Hey, everybody. Today we have Dr. Diana Stafford with us. She also goes by Dr. Diana. Dr. Diana is a mold expert. We've known each other for a while via Facebook, some of the groups, Instagram, and I wanted her to come on to talk about mold. Dr. Diana, thank you for sharing your expertise, making time to be on this podcast and educate our listeners. Thank you.
Thank you, Sharon, so much for having me. I'm really excited to be here today and talking about mold and stress, such an important topic.
So usually, as far as I know, there's not a lot of doctors that specialize in mold. So this was new to me. I remember during my residency years treating fungal infections. Those patients typically were very sick. So thank you for specializing and helping to prevent this.
Absolutely. Yeah, it's really important. And I feel like it is just not widely known. And so people don't have to be immunocompromised to be affected by mold. So important.
How did you get into this? You're practicing physician. How did you narrow down, or where did the interest come from with mold?
Yeah, absolutely. So I worked in conventional medicine for almost 10 years in private practices and affiliated with hospitals. And we lived in a home that had mold, and my family was affected by it, even though, for example, I'm not allergic to anything, immunocompromised or anything like that. But all of us had symptoms, and we connected them eventually back to the mold, even though we went down this diagnostic differential pathway of, was it this, was it that, was it just stress straight up, with no underlying, cause, just situational because of, having babies and stuff. But it came back to the fact that, when we moved, we felt better, and we eventually thought, it could have been connected to the mold in that home, and then ended up doing the testing that's now available for mold toxins in the body. And we still had some mold toxins and had to clear those out. And we can talk a little bit more about how that works. But it was a personal journey, as well as, professionally, I wanted to fit this into my practice, but it didn't fit within the model of insurance coverage and things like that. So I definitely had wanted to do these longer functional medicine visits for a while, but then that sort of sealed the deal when I wasn't able to help people who were dealing with mold and things like that within the constraints of the system, I guess. So now I have my own virtual practice, and we do mold, the gut, autoimmunity. So it's all related and super, super common. So millions of people dealing with this.
All right. How does somebody know that they may have been exposed to mold? And is there a certain group of people that may be predisposed to mold?
Yeah, absolutely. So it's really, really common. So data estimates that at least 40 to 50% of homes will have some kind of significant mold issue, like whether it's humidity or water leak. And my friends in the mold industry estimate that it's much higher than that, just not documented. Like some studies on military housing would say like 80 to 85% had some mold issue there. So it's really common. So, and we all kind of, I think, can think back, okay, if I think of a musty odor, does something come to mind? Does a family member's house or my own house growing up come to mind? So, or a college dorm room, really common. So the question is, does that matter to our bodies? And do our bodies, our liver, we have liver to detoxify things that we come into contact with every single day. And is it just going to process them out? and no worries. And in some cases it does, but in some cases it doesn't. And about 25% of people, genetically speaking, just don't detox mold well. Mold toxins their body doesn't recognize. I mean, it has to do with your HLA-DR types and your MTHFR genes. So basically, genetics plays a role. So it's very common to just hold on to these toxins in our bodies and accumulate them because mycotoxins, which are the toxins produced by mold, are fat soluble. So they can be accumulated in our fat, in our visceral fat, in our nervous system, in our nerve tissues, in our brain. So we're gonna, delve a little bit more into that. I know, relating to stress, but this, it's really common and a lot of people just don't automatically process it out. Of course, there's the spores that can irritate the lungs and things as well. And that's what we kind of were taught in med school. Okay, it's like an allergy. If you're allergic to mold, then you're going to be sensitive to moldy environments and go ahead and avoid that or take your antihistamines. But it's not, that's only one layer to the byproducts that mold can produce. And mold toxins cause a lot of these nervous system symptoms that we can talk about. So,
Let's step back. You mentioned HLA. Could you describe to the audience out there what is HLA?
yeah. So genetics. So basically, it's a human leukocyte antigen on our chromosomes, and basically it affects how well we just process out things like toxins, how well we can metabolize vitamins, and a whole wide set of different processes in the body. And, it depends on, what subtypes we have, how well we're going to process those out, basically.
You also mentioned genetic test.
Mm. Yeah. So, sometimes people want genetic testing and to see if they have, MTHFR mutations or things like that. And I will do them. However, oftentimes we will use the resources to put into other things like getting a higher quality supplements or the fact that they have to totally move and get all new stuff because of the mold. And a lot of times people will just know that they're sensitive to mold. And so a lot of times I won't do them, but if people want them, I'll definitely document it. It can be useful just to have that backup and to have that data. More information is always good.
Perfect. And then we talk about, well, stress and mold. Let's get into some of that. We know that maybe some people may be predisposed. What about the effects of like depression, anxiety, anything to do with psychiatric illnesses or mental health?
Absolutely. So as I said, people think about respiratory symptoms as being the primary or most common symptom of mold exposure, but I would say that nervous system symptoms are just as common. Headaches, of course, but things like mold rage, like that's a term for a reason because exposure to those mold toxins, they catch a ride through the olfactory nerve up to the deep brain structures. They can affect the limbic system. So basically, they can make you have unexplained mood swings. It can affect the hormones, so indirectly and directly can affect the mood as well, but can cause, people will describe it oftentimes as anxiousness, not as much like anxiety, kind of like in your head, but anxiousness, like your whole body goes into a fight or flight state. The mold will put your cells into a hypooxygenated state, uh, cause some oxidative stress, oxidative damage, and make it so that level, so causing, contributing to anxiety and as well depression. I personally had that when we lived in a moldy environment, and I'm not a depressed person in general, so it's very random. Anytime there's something really unexplained and out of nowhere, we have to kind of think outside the box, I feel like. So can definitely affect that. There have been, definitely have heard lots of other neurologic symptoms, things like, even bad dreams in children, things like dizziness, things like hallucinations, like all sorts of things, like sort of dissociations, all sorts of nervous system symptoms for sure. Yeah.
Diana, that is huge. Thank you. I don't know that most people know this. I'm so glad that you're available to help others with this.
Yeah, absolutely. And of course, for stress and mold, there's just a situational aspect as well, because number one, you can be chronically ill because of it, and it's very lonely and stressful. And also the whole aspect of it's expensive to remediate and test and get rid of the things that are contaminated or move, everything like that. So there's kind of that level too that people are dealing with as well, that's just straight up stressful. So mold relates to stress in a lot of different ways.
We had talked a little about basically the mold and mold toxins, how this can be causing chronic stress. Let's talk a little about that.
Yeah. So I talk about it through the lens of the vagus nerve, because that, of course, is cranial nerve 10, base of the brain, all the way down to the GI tract, innervating everything along the way. And it puts your vagus nerve into a low tone state where it's not functioning properly, and it's not able to keep you in the parasympathetic or rest and repair state. And chronically, people are just, pent up, very much in fight or flight, and just not only stressed, but can't, digest properly because it's also innervating the GI organs, and having issues with respiration because it's also innervating that area too. So, it's the gut brain connection literally, but also it, has a whole host of other effects. So it really affects the whole body. So yeah.
This is such great information. Tell us some tips for getting out of that flight or fright you mentioned before. How do we work on our parasympathetics, or just some tips as far as getting
Yeah.
out of that, the flight or fright?
Yeah, it can be, there's a lot of actually free and easy things that you can do, which is great. So it can be as simple as just anything involving controlled vocalization, like singing or chanting or humming, that can activate the vagus nerve and help regulate your heart rate, promote relaxation, and help with some of that stress. There's something called the basic nervous system exercise, which I'll show you because it's very quick. So I like to do this lying down, but you can also do it sitting up. You link your hands behind your head, keep the head straight, but put your eyes as far as they can go to one side, and then it will trigger a sigh or a yawn, and then do it to the other side. And it sounds kind of silly, but it really helps to relax, and it can even help you go back to sleep. There's box breathing, which is in for 4, hold for 4, out for 4, pause for 4, or 4 square breathing. So that also helps. Any kind of deep breathing exercises that really can uh, engage the diaphragm and focus on your breathing, that can stimulate the vagus nerve. So all of those things. And then there are more structured programs. There's something called dynamic neural retraining system, which a lot of MDs in this space and in the related spaces with other similar conditions will recommend people to do. And that is kind of a series of videos that you can go through and very systematically reactivate your nervous system. And then there are some supplements and things, of course, that you can take to help with the nervous system, everything from omega-3s. They can promote nerve health. Things like B vitamins are essential for nervous system health as well, especially B6 and B12. Very good for the nervous system. And probiotics can help depending on the person, and depending on the specific probiotic. And then I also will use acetyl L-carnitine, which is an amino acid that can be neuroprotective.
So when somebody is diagnosed with mold, it's usually found, like, tell us the testing. What,
Yeah.
how are they
So
diagnosed?
great question. So I will advise people to get their indoor environments tested. And I say that like that because I've even seen it where it's the car, it's somebody's work, it's their school. Of course, the home can be the case, but testing the indoor environments with air samples and surface samples, ideally working with a professional, and testing the bodies. So the most sensitive and specific test right now for mold is going to be a urine mycotoxins test. And that one tells you which toxins you're peeing out right now. And antibodies can be done, of course, to mold, but they're not as useful. And then those are kind of the things that I will normally do. And of course, some other testing depending on what other symptoms they have.
So, someone's been diagnosed. How do you then go treating them?
Yeah. So sometimes the nervous system is one of the first things that we work on because anytime, as anytime you're in chronic stress state, when you're trying to heal from something, it's not going to work. So we have to make sure that we're in a good vagal tone state and ready to rest and repair and heal, and ideally be out of those moldy environments if applicable, and doing a low toxin diet, not eating a lot of processed foods, sugars, of course. Grains are highly contaminated with mold toxins and pro-inflammatory, and other contaminated foods, of course, like tap water and certain brands of coffees and teas and stuff that we want to avoid that are just contaminated with toxins, and products like low toxin products that we're putting on our skin and things like that. And then things like binding up the toxins, things like activated charcoal can be really useful depending on the situation. Things like antioxidants, because as mentioned, mold can put your body in a state of oxidative stress. And so blasting that out with antioxidants, anything from vitamin C to NAC or N-acetylcysteine or glutathione, are very helpful for antioxidants, organ support to support the liver, anything from turmeric to milk thistle. And then I use a lot of herbal antifungals, kind of go back to basics and not a lot of prescription antifungals, but they can be useful short term, of course, but sometimes will backfire. So I do a lot of herbals, things like tinctures, like thyme, garlic, oil of oregano, things like that. Very, very effective and strong for antifungal properties. So it's kind of a whole regimen, but those are the categories that we'll normally do. And it's pretty amazing, how much effectiveness we can see with these natural supplements. And a lot of them have been very well studied to help with fungus.
How long does it take to see some changes if this is going to work, this program, with all
Yeah.
the different methods that you mentioned?
Yeah. So you ready for this? So it's not a quick, the average, I usually work with people for around 6 months, and people will see some definitely significant improvement during that time. But sometimes, we'll often do repeat testing in 6 months to make sure that we're seeing good improvement in mold toxin levels. And a lot of times it will take longer to fully resolve those symptoms, especially the nervous system symptoms. But, thankfully there's neuroplasticity and we can help the nervous system. But those are usually some of the last symptoms to go, sinus symptoms and nervous system symptoms. But we can see significant improvement quickly, especially with gut symptoms, just by sort of resetting the gut with things like digestive enzymes and things like butyrate and other supplements for the gut. But nervous system takes a little longer.
Dana, how do you find most people? Like, I would imagine this is hard to like, it's not on the top of most diagnoses, right?
No.
So how are they going around? Are they kind of lost in the system? Like, I've been to this doctor or that doctor. How do people come to you?
Usually they have been lost in the system. They have seen several doctors. And like you said, especially most MDs don't really specialize in mold. And so that's why, yeah, I'm really glad to be in this space, and able to help people with their mold issues. And, sometimes they find me on, social media. I do a lot of, lives on TikTok, for example, and people will find me there and say, "Hey, I have some of those symptoms, and I thought it was just stress or just, hormones or just uh whatever allergies, but it may be something that we can actually work on and get to the underlying cause of and go ahead and see some sustained improvement instead of just improvement for a few days."
You mentioned your social media. Where could people find you?
Yeah, thanks for asking. So I am the detox doc on social media, TikTok, Instagram, Facebook, um, YouTube, a little bit everywhere. So most of my live events right now are on TikTok, but working to expand that as well.
All right. Also, if somebody wants to work with you, how would they get a hold of you? What's your website?
Yeah, so my website is drstafford.com with the doctor spelled out. And you can book virtual consults nationwide and also across the world, in fact.
That will be in the show notes as well. Diana, for our listeners, I understand that you have a gift.
Absolutely. So I'd love for you guys to check out my info hub, which has some mold and mycotoxins info. A lot of what we talked about, but way more info than that in ebook form. There's some ebooks, there's some low tox recipes, there's a mold symptom questionnaire, and there are some discount codes on there for products as well.
Dr. Diana, it's been wonderful speaking to you. Thank you so much for your help, your expertise. I myself have definitely been enlightened. I didn't know half of this, so thank you.
Thanks so much, Sharon. It's great talking with you.
You too.